This is a case study of a 9-year-old girl with a history of urinary complaints and on investigations. It is said that she is having uretrovesical reflux, and we see on ultrasound. Now, if you concentrate on this region, this is in fact the urinary bladder in transverse section. I am maneuvering the probe. This is a magnified view. You can see the hypertrophic trabeculae with these are all trabeculations with the right and left wall of this baby. And when I move the probe cephaloid a bit, I too see the dilated ureters, both in transverse section. The left is dilated more as compared to the right one. Now, here if you see, now this is the transverse section of the dilated left ureter, significantly dilated up to 11.1 millimeter, and here you see there is a space which is entering into the urinary bladder. So the reflex is coming from this region, from the ureter. Now in this case you can see this is the right transverse section of the right dilated ureter, in which measures approximately 5.1 millimeter. And here you can see an opening, a slit-like area that is opening into the urinary bladder. So this is a proven case of uretrovesical reflux. We see both the ureters are dilated and they open into the their opening into the urinary bladder can be clearly seen. Here you see this is the left ureter, right ureter entering into the urinary bladder. Now the status of the kidneys is such that this is the right kidney of this child, and this is the upper pole. In the upper pole region, the parenchymal thickness is preserved, 11.1, and in the mid region it's also preserved, approximately measuring 11.6 millimeters, whereas at the lower pole, this is the lower pole, the parenchymal echogenicity is 11.1, so almost preserved parenchymal echogenicity almost at all levels, though we do see moderate to massive hydronephrosis. All the calyces are seen dilated, as you can see. All the calyces are dilated, as is the proximal ureter does not seem to be dilated. Here you see the proximal ureter is now dilated. It measures approximately 3.6 millimeters, normal is up to 7 millimeters. This is the pelvis of the kidney, and the kidney in total measures approximately 9.5 centimeters in length, 4.7 centimeters in anterior-posterior diameter. This is the transverse section, and you can see that the parenchyma is preserved, though globally raised parenchymal echogenicity is obvious. So these are the dilated calyces in transverse section. Here you can see the right renal vein entering the hilum of the right kidney. No calculus is seen, no focal lane is seen. Now when we compare the parenchyma of the kidney with that of the liver, we see that the parenchyma of the kidney shows almost equal echogenicity as compared to the adjacent liver. So this is normal for the parenchyma of the kidney. Now the status of the left kidney is that now it shows massive hydronephrosis. Massive means that all the calyces are dilated from upper pole to the lower pole massively, with thinning out of the parenchyma. Parenchyma cannot be made out. You cannot see the parenchyma, only the capsule of the kidney is seen, and the dipping sign of massive hydronephrosis is seen. And another thing is that in this case also there is dilation of the first let us see and measure the kidney. The kidney is a bag of fluid measuring 10.8 in length and 4.5 centimeter in anterior-posterior diameter, and this is a dipping sign. This is called the dipping sign. The capsule is intact, no calculi seen, no sludge seen in this kidney, and this is the transfer section of this kidney. Now the proximal ureter does seem to be dilated in this case, but it becomes narrow in this region, and I cannot trace it from here onwards. This is the proximal ureter. Proximal ureter measuring 11.4, normal, it should not exceed more than 7. Now these are the bowel shadows which are obscuring the view further, so I can trace the kidney only up to this level. So this is a case of, here it is, the left kidney is massively hydronephrosis, and there is, now you will see debris within the urinary bladder. There is a layer of echoes within the dependent region of the urinary bladder. This is the debris. No ascites is seen in this case. So this is a case, proven case of uretrovesical reflux with consequent sequelae. Long-standing, this is a long-standing history. Years. His first presentation to me was 2 years back with the history of retarded growth, and that I mentioned all these things 2 years back, but she was surgically manipulated with no positive result. Thank you.